Today I'll be talking about the Boston Diagnostic Aphasia Examination. This is a tool used to evaluate language functioning in individuals who've experienced a neurological injury, more commonly a stroke. It helps clinicians identify the severity of aphasia and the type, and it helps describe the individual's language strengths and weaknesses. The target population is for adults with acquired language impairments due to neurological conditions. This may include stroke, TBI, brain tumors, or other neurological diseases. The domains assessed for this assessment are conversational spontaneous speech, auditory comprehension, repetition, naming, word retrieval, reading, and writing. In addition to language skills, this assessment includes measures that help identify common aphasia syndromes such as Broca's aphasia, conduction aphasia, Wernicke's aphasia, transcortical aphasia, global aphasia, and anomic aphasia. I would choose this tool when I need a comprehensive assessment of language following an acquired brain injury. If a patient has persistent word finding difficulties, impaired comprehension, or their speech changes after stroke, this is when I would give this the assessment. One of the strengths of this assessment is that it not only tells the type of aphasia, but it also gives a severity of the aphasia as well. And it helps to identify specific areas of impairment because the assessment is so comprehensive. It's also really flexible, so the clinician is able to administer the test in short form, which is the shorter version, standard form, and extended testing, which is a more comprehensive assessment, but it takes longer to administer, up to 2 hours. So I really like this tool because it provides a comprehensive evaluation of the individual and their language impairment. I feel like it would be an appropriate tool to use for individuals with language impairments, and I think the limitations are that it's time consuming. At times you need to be trained to give this assessment. If not, the results will be invalid. And I did not like how some instructions weren't clear if you needed like extra time, or someone say like repeat this as many times as you can in 5 seconds, but there wasn't like a clear like stopping point. So I feel like the other thing was that there's a record booklet and then there's an assessment manual, and I wish some parts of the assessment manual that gave more detailed instructions about the subtest were just in the record booklet itself, so you weren't going back and forth. And I feel like also that there's some parts of the test that would be harder for those with a different educational background, like don't have different literacy skills. So those are the main things I didn't like about this assessment. But yes, that's the Boston Diagnostic Aphasia Examination. And yeah, that's it.